Sports-related injuries are very common nowadays. We have both the young athletes, the older athletes. We can see injuries in sports, including repetitive injuries or acute injuries or traumatic injuries from like a fall on an outstretched wrist. Some of the more common injuries that we see are distal radius fractures, scaphoid fractures, ligament tears in the wrist, tendon ruptures in the hand, or even ligament injuries in the fingers. As a hand surgeon, we see a lot of recreational and competitive athletes, and almost every one of them wants to get back to their activity as soon as possible. Many of these patients we have to kind of protect with either a brace or a splint. There are some injuries that we see in the hand that absolutely need a short period of shutdown or rest. We can see injuries that could be from repetitive strain, which could be stress fractures. We also see ligament injuries from overuse or tendon injuries from overuse, and many of these patients require a short period of time where we shut them down so that your body has a chance to heal, and then we slowly build them back up in a rehab program. Many of them are able to get back to their sport with protective equipment so that we can protect them from themselves so they can enjoy their recreational or competitive sport but do it at the best level possible. Some of the risks involved in returning too soon, and some of our athletes are very aggressive and they want to get back the next day, is the one they could re-break a bone, they could rupture a tendon, they could stretch out a ligament that we've been trying to heal. So it's really important that if you have a sports injury, that you see a hand surgeon who can guide you through this, because their goal is the same as yours, is to get you back safely to that sport so that you can compete at the highest level. Returning to sports can be a tricky thing. We want to make sure that we're getting people back to sports safely. Some of the things that we can do to get them back early is do some things like splints, like a buddy tape to the fingers or a brace to the thumb. What we want to do is make sure that people are safe when they return so they don't end up getting put back out of sports for a longer period of time. So many times if you can protect them early, you're able to have a longer and quicker recovery to a sport in the long run, as opposed to trying to get back right away, and then you're going to be out of that sport again for a longer period of time and could actually cause greater damage.